President Goodluck Jonathan says he'll commit $33.4 million over the next 4 years to procure medicine and commodities to prevent at least 1 million deaths of women and children by the year 2015. The president made the pledge while launching the Save 1 Million Lives program in the presidential villa, in line with the United Nations report, which listed 13 commodities that could save at least 16 million lives. He said that with the support from partners, the country has so far been able to address diseases that account for over 50% of child mortality in the country.
The federal government of Nigeria has called together development partners drawn from home and abroad. They are bothered that year after year, approximately 1 million women and children die in Nigeria from largely preventable causes. President Goodluck Jonathan says enough of all that. The president is co-chairman of the United Nations Commission on Life-Saving Commodities for Women and Children. He is to commit money from everywhere, including the subsidy proceeds, to prevent Nigerian women and children from dying.
We are committed to a total of $33.4 million over the next 4 years for the procurement of additional quantities of reproductive health commodities, representing a 300% domestic funding increase. We have also ring-fenced $500 million over the next 4 years for maternal, newborn, and child health interventions under the Subsidy Reinvestment and Empowerment Program.
The co-chairman from Norway sent a representative, and she did not come empty-handed. She cited examples of how her country was ravaged by death and poverty. Today there is a turnaround just because the government gave attention to women and children. She says Nigeria can do the same.
Strengthening women's empowerment is one way to make a high return investment in better health, not only for women themselves, but also for their families and for society at large.
Speaker after speaker reeled out a commitment to the cause.
In the 21st century, no child anywhere in the world should die of diarrhea.
We are committing ourselves to providing dignity kits for women in the flood areas in Nigeria to ensure that women can have dignity.
Nigeria currently stands at the threshold of what could be the greatest transformation in its history. By 2030, it will be one of the few countries in the world that has young workers, a plentiful supply. Our youth, not oil, will likely be the country's most valuable resource later in the 21st century, as Nigeria stands to reap a substantial demographic dividend.
President Goodluck Jonathan took time out to inspect some of the products on display at the launch venue. It will be recalled that the United Nations Secretary General has criticized the inequitable access to life-saving medicines and health supplies encountered by women and children around the world, and called on the global community to work together to save at least 16 million lives by 2015. Chukwuma Onwekusi, Channels Television News.